Hi, I am Matthew Krasowski. I'm the Vice Chair of Clinical Pathology and Laboratory Services and also one of the Associate Residency Program Directors. My clinical area specialty is clinical chemistry and toxicology. I have also done a lot of research in this area. Together with Dr. Anna Merrill, I primarily work with pathology residents on their chemistry and management rotations. In addition to teaching clinical chemistry and toxicology, I am passionate about teaching principles of laboratory management. This is an area that can be challenging to teach, but is essential for pathologists entering clinical practice. My aim is to familiarize residents with a broad range of management topics and problems by having the residents meet with key people in laboratory administration, work through example management vignettes, and participate in quality improvement and management projects. My aim is that a high percentage of these projects will ultimately be published in peer-reviewed journals and presented at national or local meetings. Examples of published resident management projects include determination of reference ranges for laboratory tests in the transgender patient population, successes and pitfalls with a new HIV testing algorithm, and use of umbilical cord tissue instead of meconium for newborn drug screening. I'm always on the lookout for possible projects, and residents frequently come up with ideas of their own. An example of this was a resident in her very first chemistry management rotation who came across an issue that had been described in the literature but was still causing issues. This was patients who received hepatitis B surface antigen testing within 2 weeks of getting a dose of the hepatitis B vaccine. Since the vaccine contains surface antigen, testing will be positive for about 2 weeks after a vaccine dose. In doing the investigation, the resident found that most occurrences were happening in dialysis clinics that routinely test hepatitis B surface antigen at regular intervals. Occasionally, a patient would happen to get a vaccine dose, usually by another healthcare provider, that was close in time to the hepatitis B surface antigen testing. This is resulting in patients being erroneously labeled as hepatitis B positive, which created a number of downstream issues for the patient and the dialysis clinic. Based on this project, we implemented education, but more importantly, warning alerts in the electronic medical record that have reduced this problem to a very low occurrence. As an associate residency program director, I am most focused on CP education. We've made numerous improvements over the last decade to make the CP education at Iowa top-notch. This includes integrating a structured informatics curriculum. Thank you very much for considering our program, and I hope to see you soon.